So, welcome everyone to today's New England PTTC webinar, Truth or Hysteria, Investigating Cannabis-Fentanyl Contamination. Very happy to have our presenter for today, Bobby Lawlor from the New England High Intensity Drug Trafficking uh,
area.
area. There's so many different options for the A's. I should have looked it up. Or New England HIDTA, as we say. Um, I have a couple of notes before we begin. Like I said, I'm going to keep it brief here. The New England Prevention Technology Transfer Center, or PTTC, is a program funded by SAMHSA at the Department of Health and Human Services. The contents of the New England PTTC products, including this webinar, are those of the authors or speakers and do not necessarily represent the official views of or an endorsement by SAMHSA and HHS. If you haven't been to your regional PTTC and you're joining us today from outside New England, I'd encourage you to check out pttcnetwork.org to connect with your regional center, as well as you're always welcome in our PTTC New England webinars as well. I'm going to skip through this section. And just a couple notes, we are in a Zoom webinar format today. That means participants won't be able to unmute or share your videos, but we do have the chat as well as the Q&A box open. Please feel free to add questions as we go through the presentation today. We will try to save a few minutes at the end for Q&A. There will be an evaluation survey that should appear automatically when the webinar closes. And I will be emailing certificates to folks, ideally within 2 weeks of the presentation. So without further ado, I'm going to go ahead and stop my share and turn it over to our presenter today, Bobby Lawlor, who has a ton of great info for us today. So thank you all for joining.
Thanks, Kristen. See that all right?
Yes.
Great. So, afternoon, everybody. Appreciate everybody being here. The topic is Truth or Hysteria, Investigating Cannabis-Fentanyl Contamination. So, I am part of the overdose response strategy, which is funded through ONDCP and the CDC, and it puts a public health analyst and a drug intelligence officer like myself in every state, including the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. Some states like Texas, Florida, and California have multiple teams, but there's at least one team in your state. This is a QR code that'll bring you to our website, or you can use orsprogram.org. I know there's a lot of people from all over the place. I would strongly encourage you, if you're not already connected to your ORS team, to go to the website and contact your team. There is a list there, lists all the teams and the states and the areas they cover. But the purpose of the program is to share data systems, support evidence-based responses, design and use promising strategies at the intersection of public health and public safety, and support evidence-informed prevention strategies. So, and as Kristen said, my name is Robert Lawlor. Most people call me Bobby, and my official title is Drug Intelligence Officer for New England HIDTA. And my background is primarily in law enforcement. So I just wanted to start. This topic is one of the topics I do a lot of discussions about over the years, and it's one of those ones that bring up a lot of feeling. So I just wanted to put this here just to say, some of this topic, depending on your belief system and what you believe about this topic, could be difficult for you to hear. So just please take care of yourself and step away if needed and rejoin when you are ready. So, myth busting, marijuana laced with fentanyl, fact from fiction. So, as of today, there has been only one confirmed case in the United States of marijuana contaminated with fentanyl. And when we say confirmed, we mean confirmed by a laboratory. a laboratory who has done testing and has confirmed the presence of fentanyl in the marijuana cannabis sample. This was confirmed by the Connecticut Forensic Laboratory and verified by the DEA Northeast Laboratory. After this finding, the Connecticut Department of Public Health, and then separately, the Connecticut State Police, working with the DEA, conducted 2 separate reviews and investigations into this incident, and both concluded that the most likely explanation was accidental cross-contamination, specifically marijuana placed into a container that had previously held fentanyl. In addition, whenever suspected fentanyl-laced marijuana incidents arise and they are sent to a laboratory for testing, I'm stressing the word laboratory, results do not find fentanyl in the suspected cannabis. So why do we have these myths and this misunderstanding? To me, there's 4 buckets that really play a part in this. The first one is a misunderstanding of fatal toxicology results. The second one is a misunderstanding of forensic evidence testing. The third one is grieving loved ones. And then the fourth one, unfortunately, is law enforcement. So misunderstanding of fatal toxicology results and what is toxicology. So the National Institute of Environmental Health Sciences at the National Institute of Health defines toxicology as a field of science that helps us understand the harmful effects that chemical substances or situations can have on people, animals, and the environment. So toxicology is what is in the body. Again, toxicology is the results of what is in the body, and just write that down or hold that, because that's an important piece of what the misunderstandings are. So toxicology testing is defined as laboratory testing for drugs, poisons, and chemicals and biological samples. What it answers is, was the person exposed and what substances are present, how much is present, and what the results may mean clinically or medically. Common specimen types are blood, urine, tissue, oral fluid, and sometimes hair. Typical output: detected substances, concentrations when applicable, and interpretation and context. But I want to bring you to the third bullet point: common specimen types: blood, urine, tissue, oral fluid, sometimes hair. Again, these results, toxicology results, give us results of what is in the body. So the next piece of this is a misunderstanding of forensic evidence testing. So what is forensics? The science of forensics, often called forensic science, is the application of scientific methods and laboratory techniques to recognize, collect, analyze, and interpret evidence so it can answer questions relevant to a legal investigation and be communicated in a way that is reliable for courts. Forensics, for this context and what we are discussing, equals what is in the substance, not what is in the body, but what is in the substance. So the definitions of forensic testing is scientific laboratory testing of evidence for legal and investigative purposes. In drug cases, what it answers is what is in the substance, what is it made of, does this seized item contain fentanyl or other drugs? Common evidence types: powders, pills, residues, plant material, paraphernalia, packaging. Typical output is identification of substances present in the evidence, often with confirmatory methods suitable for court. Again, a couple things I want to point out is scientists do the forensic testing of the substance, held up to accreditation standards and protocols to the point where they are called to court to testify on their testing methods and what they found in the samples they are testing. So toxicology versus forensic testing, key differences. So primary question, toxicology answers is what is in the person. Forensic drug evidence testing is what is in the substance or item. The sample type for toxicology is biological samples, and the sample type for forensics is physical evidence items. What a positive result can prove, toxicology positive for fentanyl supports exposure to fentanyl, does not prove the source or indicate the source of the fentanyl. Even now, if you go to your Office of Chief Medical Examiner website or your coroner's website, if they have one, and they make public unintentional drug deaths or fatal overdose toxicology results, even when you see fentanyl in those results, you don't know if the fentanyl arrived in the body through inhalation, through intravenous use, through pills, through smoking. You don't know how that fentanyl got in the body. What the toxicology tells you is it was present in the body, and at some point prior to death and in close proximity to death, the person who died was exposed to fentanyl. Forensic or evidence positive for fentanyl supports fentanyl in that item. So again, there are two different things that you have to look at together. A forensic evidence does not tell you whether it was in a person's body or how it got in the person's body. It tells you what was in the sample. So if law enforcement seizes cannabis and they test it, the forensic testing will tell you what is in that cannabis sample. Just like if law enforcement seizes twist corners or wax folds or Ziploc baggies or pills, and they send them as evidence to the lab for testing, the laboratory will tell you what is in those samples. Again, that's the main difference. Exposure and source are different questions, and they require different tests. And that's, I think, where there's a lot of misunderstanding. If you see toxicology results that have fentanyl and THC or cannabis, however, your OCME or coroner decides to list it on the record of death, on the death certificate, that tells you what was in the person. It does not tell you how those substances got there. The only thing that can tell you whether or not there is substances in a sample or is forensic testing. So there are two different questions and there are two different sources of information that need to be looked at together to understand this topic. So this is one of those areas that I think is very difficult to discuss when you're discussing this topic, because unfortunately, I think a good amount of this myth of fentanyl and the cannabis supply, unfortunately, comes from grieving loved ones who misunderstand toxicology results and what toxicology results actually indicate. And so it's very difficult to discuss because you're discussing it with somebody who is obviously grieving, has lost a loved one, and is trying to understand and cope with how that loved one passed away. And after an overdose death, families are often handed a toxicology report during intense grief and shock. They may see THC listed along with fentanyl and assume the substances were in the same product. Again, that's not what toxicology results show. They show what is in the body at time of death. Stigma around opioid use can make it emotionally harder to accept fentanyl or opioid use as the true cause. Um, and I think this is, again, a very difficult topic to discuss, but a big reason why this myth continues on is because of the stigma around having an opioid use disorder and the difficulty loved ones have with admitting that their loved one may have had an opioid use disorder. Cannabis is widely viewed as common or safer, which can make it was laced feel like a more acceptable explanation. Because cannabis is common, it's more normalized. There's very little stigma around using cannabis or cannabis products. It's easier for a loved one to gravitate to, well, my loved one's cannabis must have been laced with fentanyl. That's how fentanyl got in the body. And that cannot be really further from the truth. Without clear explanation, toxicology results can be misread as proving source rather than only showing exposure. Again, stress this several times so far. Toxicology results can be misread. So toxicology is what is in the body, not what was in the substance. The results can be an understandable and human narrative that gives life to the myth, even when product testing does not support it. Was there any questions before we get into this law enforcement topic that people have?
There was a question, I think you kind of addressed it, about um, confirm, kind of addressing unconfirmed reports of fentanyl laced marijuana when most cases are not sent off for thorough testing. And there are, investigators in the area who have heard from drug dealers that there are advertising fentanyl and marijuana together.
Yeah, so I'll let me come back to that after this. Let's put a mark there because that is an interesting topic. And that comes up a lot in this, so I'll address that at the end. So law enforcement. So I'm sure a lot of people have seen either these exact headlines or headlines very similar to these. And I think this is probably one of the bigger reasons why this myth continues, and it's very hard to break this myth and really get the true nature of what is going on out there. And what these are is basically headlines or press releases or press conferences from law enforcement officials across the country. However, me being in Connecticut, I use the Connecticut Norwalk PD one as the top headline. And specifically because me and my public health analyst counterpart actually worked on this case with the state of Connecticut Forensic Laboratory and the Norwalk PD. And again, I think this one case will show a lot of what occurs. So the Norwalk PD had an investigation into a vape shop that was illegally selling cannabis. Connecticut does have recreational cannabis and medical cannabis legal here in Connecticut. However, vape shops cannot sell cannabis. You can only buy recreational cannabis from a dispensary that is authorized by the state of Connecticut, and vape shops don't fall under that. The Norwalk PD went in there and they seized quite a lot of actual cannabis, along with THC products and edibles and all those other things. And when they were testing the cannabis, they got positive indications for fentanyl. And I think this what happens, and this is what Chief Walsh did, who is a great chief out in Norwalk and does the best to be transparent and support his community out there in Norwalk. They believe they have a duty to warn their constituents and their communities about dangerous situations. And fentanyl-laced cannabis would actually, if it was actually fentanyl-laced cannabis, would constitute a public health issue that could cause mass overdoses and even fatal overdoses. So I think what occurs is when law enforcement does this testing and they get a positive result for fentanyl, they believe they have a duty to warn their community about this issue. And I think because of this, they're put in a precarious situation that leads to the misinformation of fentanyl-laced cannabis or marijuana. And what happened is, so we talked to Chief Walsh. He had that day, the morning after this headline came out, we called him, we called the forensic laboratory. Chief Walsh had a police officer take all the cannabis out of evidence and drive it to the forensic laboratory in Connecticut. And even though Connecticut is a small state, it's quite a bit of a drive through one of the worst congested highways in Connecticut and in the country, being 95 into New York. From the Norwalk area is one of the most congested highways in Connecticut in the country. Drove it to the forensic lab, which is over an hour away, so the lab can do the testing. The laboratory did the testing in an expedited manner, and the next day we got the results that the lab did not find any fentanyl in the cannabis samples. So again, this shows when there is actual laboratory testing done, the results always come back, except for that one case out of Connecticut, with no fentanyl in the cannabis. And the reason for that is a little bit complicated, but it's also simple at the same time. So these are the primary devices and items law enforcement uses to test narcotics or drugs out in the field or at the police department. And you have the NARC2 pouch, the NARC tubes, the True NARC, the Pendar, the MX908. And I've used them all. And pre-2013, before the chemical synthetic wave of drugs that we are currently in, these were all extremely accurate. However, since this new kind of move in the illicit drug environment to a more chemical-based drug environment, and different drugs inside of drugs, these testing methods have become kind of unreliable. So this is a quality control review of a lot of the different systems that law enforcement uses to test narcotics out in the field and in the police department. And as you can see, the best scores are in green and the worst scores are in red. And really the only group of scoring that gets a good score through these machines is the false positive. Very few of them give a false positive. But what you do see is that a true positive is below 25% for every single one of them. I think the highest is 23% for the ion scan. And so this causes an issue because these machines have been, sold to law enforcement by these companies as being reliable and being able to detect these substances. But when you actually do a quality review of these products, what occurs is this. And there is a lot of reasons for this. And really it's the chemical cross reactivity. So again, law enforcement often relies on presumptive field testing for drug identification. Again, this is a presumptive field test. And all of those headlines I showed you, all of these headlines are the result of presumptive law enforcement field tests. They are not the result of laboratory testing to confirm what is in these substances by an accredited laboratory in the United States. And then what happens is, so one of the reasons why a lot of these results are unreliable is the chemical cross reactivity. Many substances trigger incorrect results. Again, this goes back to this whole, we're moving from, plants to chemicals. There's a lot of chemicals in the drugs out in the street. The drugs on the street have different chemicals in them. And even going back to that Norwalk case, one of the things that occurred is the marijuana that was being sold at that vape shop that Norwalk PD seized had what is called THC crystals on them. So those THC, I think it's THCA crystals, actually. Sorry about that. They're inert until they're exposed to heat. And then they have over a 90% THC effect. And so that again is showing, like, not only do you have just the regular cannabis THC in the CBDs, which are in cannabis plants, but now you have this added THCA crystals on there, and you're talking about chemicals testing chemicals, and you're having this cross reactivity. The synthetic drug evolution, there's constantly changing formulas, outpacing libraries. Again, they're always genetically modifying not only the fentanyl market and the synthetic cannabinoid market, but also the regular cannabis market. They're splicing cannabis strains together. They're adding things like the THCA crystals to it. They're doing all these different things, which makes testing this stuff extremely difficult. The handheld devices have limited accuracy, unable to detect new chemicals. A lot of the handheld devices, they come with a library that by the time law enforcement gets it is, maybe 6 months old. And, a lot of times these aren't updated on a regular schedule. So they're, really, they become outdated pretty quickly in this new environment we're in. Then environmental and health and human factors, contaminants, lighting, and interpretation areas impact results. So all of these things lead, unfortunately, law enforcement a lot of times to unintentionally give not the correct information when we're talking about the fentanyl and cannabis issue. I try to make this a 30-minute presentation because usually I have a ton of questions about this topic. And I wanted to leave enough time to answer all those questions in detail. I'm going to stop sharing. And I know one of the questions I told you to put a pin in was, so I think a lot of times people equate business and logical business practices to the illicit drug environment. And one of the things is you can't do that. Well, I guess it is a business, and it's a very big business. It would probably be, on the Dow 500 if it was a publicly traded company. At the street level, it's not done the same way as like a franchisee would do a McDonald's. Um, so, you know, advertising something is different. Dealers saying, I have fentanyl laced marijuana. Well, we have a robust community drug testing initiative here in Connecticut. We do a lot of testing, of law enforcement seizure data. We also work very well with and very closely with the Connecticut Department of Health and the Office of Chief Medical Examiner. But that's just not a Connecticut thing. Those partnerships also are in New York City, in New Jersey, in Massachusetts, in Rhode Island, in New Hampshire, in Vermont, and Maine. And a lot of the states, especially when you think about the greater Northeast area, and even the West Coast has very robust drug testing. And there's a lot of states in between that also do. And again, you talk to like NMS labs or the CFRSE labs, they don't see this either. So nobody is seeing fentanyl laced cannabis anywhere in the country. And again, unless it's confirmed by a laboratory, it's kind of hard to say, yes, this is an actual thing. Because even law enforcement using presumptive testing, that is just a probable cause indicator. If that case goes to court, you can bet that sample is going to a forensic laboratory in that state, or whatever forensic laboratory for the state covers that area, and it's going to be tested by a scientist in their laboratory to confirm what is in that sample. And that scientist may and very well likely will have to go to court and testify on their education, on the lab's accreditation, on the methods they used, and what they found in that particular sample. So that's the only way you can positively say that there is actually a contamination issue. And again, we don't see it. We had that one case back in 2021. We did a pretty exhaustive investigation into that one case. Again, two separate, one law enforcement, one public health. They both came to the same conclusions, independent of each other. And, so again, it's a very difficult topic because of the lot of the different buckets we talked about. But I see some questions popping up, so let's go to them.
Yeah, we've got some questions there in the Q&A. I did see a comment from Julia in the chat too that she noted in the reality of people who make money off these markets is that there's lower profits in the marijuana market. So it doesn't make a lot of sense for them financially to be lacing marijuana with more expensive products in some ways.
Yeah.
And
So I'm looking
an
at
interesting thought.
Jack Swan's question in the Q&A. Yeah, it's a very, like, again, I stress it's a very difficult topic because of that reason. And I'll be honest, it depends. I've had this come up a lot, and it really depends on the setting. If we're in a public setting, I kind of just hear the grieving person out and I give them my card and tell them, I'd be more than happy to discuss this more in detail in a private manner, either on a phone call, or we can meet and have coffee, or that we can Zoom, because I do know it is a touchy subject. But, again, I think the problem is when you have grieving loved ones who are out there, kind of starting nonprofits with the whole gist of their nonprofit is there's fentanyl laced marijuana and this is a major issue when it's not. And so, like, if it's just a grieving person who's kind of just grieving and going through the grieving process, I kind of just let them grieve. But if I feel like they're, kind of perpetuating this myth, I kind of I try and address it in the most compassionate and empathetic way I can. And I'll be honest, a lot of times I don't think I get through to them because I think they're not in a position to actually hear things that are difficult for them at that moment because of where they are in their grief journey. Um, so it's a very difficult topic. Then I see Sarah Bean. I lost. How do you approach law enforcement judges that are spreading or enforcing these ideas that fentanyl is in everything, specifically youth use, including THC vapes, nicotine, and THC, especially in states where THC is not legalized, but there is a significant amount of THC. Yeah, that's a very difficult one. We've been trying for years, and we've done a couple to get in and do trainings for judges um, on the illicit drug environment. They're a difficult group to get into. Um, the law enforcement one also is, speaking specifically for myself in Connecticut, and I know my counterparts pretty well in the surrounding states in, New England and the New York, New Jersey area. We have great relationships with our chiefs, our sheriffs, our colonels of our state police. But again, they're weighing this idea that, well, the testings, our field testing is telling me this. If I wait and this is an issue, do I cause more harm? So it's a difficult thing for them. We try and do as much training and as we can for them. But again, a lot of times politics wins out in some of these cases. And, again, I don't think the Chiefs are intentionally doing anything wrong. But it is a very difficult conversation. And, like Kristen and I was talking before the webinar went live, and, you know, there's a lot of different buckets, but I feel like the one of the bigger buckets, one of the two bigger buckets is, well, really the three big buckets are grieving loved ones, the unintentionality by law enforcement, but then one of the groups that people don't talk about enough is a lot of people who are pro safe supply also co-opt this topic and like to spread this information as a way to force a safe supply agenda in their state or their area. Um, so it's one of these topics that is so controversial and so difficult to stop the myths, that everybody co-opts it and everybody perpetuates the myths because it feeds into their own agenda or their own belief system. So I see, oh, the other thing too, though, Sarah, THC vapes, major issue. Major issue. Even a lot of times, I think one of the issues with the THC vapes is I think a lot of people really truly believe the narrative that THC is not dangerous. There's no adverse effects to THC, because I will tell you, one of the things we see here is students, high school age students, will be on a THC vape that's 99% THC all day, and then they'll have adverse effects. But because the adults, teachers, and principals don't equate these symptoms to THC, they immediately go to, oh, this must have been fentanyl in the THC. And again, we have a pretty good relationship with our law enforcement and our school systems here, that we work with them and we get those vapes seized and sent to the laboratory for testing, and they all come back as just THC vapes. We don't find fentanyl vapes. So again, the THC is a major issue. And then I see Emma, I may have missed this being late. What is the metabolism rate of fentanyl? Uh, could a cannabis, that's a decent question. I don't have the exact metabolism rate of fentanyl, but it is pretty quick. But what happens is it breaks down into oh God, I'm going to butcher this word, diacetylmorphine. because you got to remember it is an opioid. So it, depending on how long it's in the body, it'll start breaking down into other opioid metabolites. But it is detectable for a decent amount of time. Let me see, Jack Swan. Yeah, I agree. Yeah, thanks, Jack. I mean, is it worth it? That's not my area of expertise, even though I do a lot of PSA stuff. But I don't know. Again, I think a lot of it comes down to funding and who's going to fund it. I don't think it'll hurt, but again, it's funding and who is going to fund it. So Chris Lee, I was taught in another webinar a couple of years ago that fentanyl don't burn at the same temperature as the nerve they are being laced. Is that true? So yes and no, but you also got to understand that it's more a money thing. I can't stress how much of a moneymaker illicit cannabis is. It is such a moneymaker that you are not across a population going to get drug dealers and cartels and drug trafficking organizations to be lacing fentanyl on the marijuana when they are making a ton of money off of both products. You know, listen, when I was a cop, one of the things a lot of people like to do is sprinkle crack cocaine on their marijuana. People weren't selling crack cocaine and marijuana in the same bag. Dealers would sell marijuana in a bag and crack in a bag. And that's how they would sell it. They were selling it separately, but the same dealer would have the products on them. So, like, that's what you see. You see people selling marijuana separately and fentanyl separately. They're not mixing these things. And but the burn, one of the things about the burn rate or the burn temperature of fentanyl is a lot of people say that it it becomes inert at a different temperature, which is true of pharmaceutical grade fentanyl in lab results. I think it's something like 660 degrees Fahrenheit is it becomes inert, and a normal Bic lighter is like 1200 degrees Fahrenheit. So a lot of people say, well, no, even if it was in the marijuana, it wouldn't matter anyways. Well, um, I will say this, you know, one of the one of the issues with the burn rate is even in like something like crack, where we have actually seen lab results showing crack of fentanyl in the crack supply. This is earlier days. We don't really see that too much anymore in lab results. But early days, we would see, about 10 or 15% of the crack cocaine supply had fentanyl in it. I'm talking like pre-COVID days. You know, you're heating different parts of the rock at a different time. So you can still inhale and vaporize fentanyl and inhale it. So yeah, the part that maybe has the direct flame and is 1200 degrees Fahrenheit, maybe that becomes inert, but the fentanyl at the top of the rock is just vaporizing and now you're inhaling it. So there's all, I mean, it's a very, the burn rate is such a complex issue that we could probably spend another hour discussing that. I have a research article that states they have found contamination in cannabis, in cannabinoids, albeit it was only. I'd have to look at that, but when you say cannabinoids, are you talking about synthetic cannabinoids? Because, are you talking about bud marijuana? That's from Richard Ochino. I haven't seen that article, Richard. I'll have to look at it. But again, like you said, less than 1%. So you're talking about, 0.3 of a percent. They found it, but I'll look at that. He's also asking if we do youth a disservice. I don't see it that way. Well, one, I don't think we should. I don't. Again, I'm not a prevention specialist, so I'm going to stay with that. But my thing is, I think we should more discuss when we're talking about prevention for youth. You know, how to keep them from using any substances. Do that general prevention. Cannabis, alcohol, cigarettes, tobacco, vaping. You want to keep them from making those bad decisions. And, I was probably a little bit clunky on that. And my public health analyst, who is actually a prevention specialist, will probably be mad at me for being so clunky, but more of those messaging rather than like specific messaging on the topic. Um, Yeah, so Thomas Rowland asking about what I would call it unintentional cross contamination. And Thomas, we saw that a lot in again pre-COVID. I don't know if they went to a class or something, but they seem to have gotten better with this unintentional cross contamination. Could it happen? Yeah, but you're talking about I think specifically with cannabis, you're talking about such a small percent that it would happen that it would probably not even be noticed. But what we see, because you're talking powder to powder and like fentanyl and cocaine and things like that, is yes, you have more of a cross contamination risk. But even when we look at those samples that do have fentanyl in it, they're at trace amounts indicating it's an unintentional cross contamination. Just like you said, they don't clean surfaces, they're not cleaning scales, they're not cleaning spoons and bowls and all those other things. So we do see, even now we see like less than 3%, but it's about a little over 2.5% of the crack and the cocaine supply here in Connecticut. We see trace amounts of fentanyl in it, and we believe that's from cross contamination. What other drugs do you see contaminated with fentanyl? So Peggy, nowadays, we do, like I said, less than 3% of the cocaine and crack supply we see um, unintentional cross contamination of fentanyl, but that's really it. There, you know, what we're really seeing is other active substances in the other supplies, not fentanyl. So like cocaine, we're seeing cocaine and methamphetamine and acetaminophen and other synthetic cannabinoids in that supply, um, rather than cocaine and fentanyl. Even in the fentanyl supply, we're seeing fentanyl with parafluorofentanyl, with a tramadol, with other opioid based active substances, rather than seeing like fentanyl and cocaine or fentanyl and meth, or meth and fentanyl and those types of things. Um, but we are seeing a lot of poly substances in the drug testing that we do, which is when we say poly substances, what we mean is multiple active substances in a dosage sample or a street level sample. So Jackson, DA agent in my area has reported that there is a dealer who advertises selling marijuana dusted with fentanyl, which also makes it, even if there is no pull through effect. And yeah, I mean, Jack, I hear what you're saying. I mean, that's a tough one to really answer, because even, not to make this more complex, but we also have to remember the end user can do whatever they want. If I'm a person who it wants to use marijuana and fentanyl, and I decide to pour my fentanyl onto my cannabis bud before I put it in my bowl or put it in my blunt or whatever I'm going to use to smoke the cannabis, uh, you know, I can do that. But that's a different topic than, oh, the high school kid who's just looking to get marijuana is going to end up with marijuana unintentionally laced with fentanyl or intentionally laced with fentanyl, or either or. And again, what I'm trying to stress in this presentation is across the population and across, you know, what we see, we do not see this as any sort of issue or even occurring. Lisa Simpson. Yeah, I agree, Lisa. Good point. Yeah, so Jack, again, the San Diego one, if you really read into that, that is an isolated case. That guy, he was connected to the Navy or some military service out there. Um, he soaked fentanyl in e-liquid and uploaded it into a vape. A couple of vapes, and him and I think four of his friends had used it. Again, you can't control what the end user does, but are drug dealers or even dark web sites selling fentanyl vapes? No. But again, can a person go buy fentanyl? It's very soluble, you know, put it into some e-liquid and upload it into a vape cartridge? Yes, they can. But again, you're talking about isolated incidents. There's another one, I think, in Kansas or Kentucky from a few years ago, too. Same thing. A kid did it, not a kid, but young 20s, I believe, did it. And one vape, and him and two or three of his friends smoked it, and they all had a reaction or overdose. Heidi wants a potency in marijuana. Um, So yeah, the potency in marijuana is very difficult. It's very high. So what we see is most cannabis uh marijuana is above 30%, and usually above 35%. And when we talk about THC vapes or THC edibles, they're above 90 and actually pushing 98, 99%. Dabs and oils are 98, 99%. So, and then, I think there's a lot of evidence coming out now that these high THC products, whether it's cannabis or vapes or oils or dabs, are causing some adverse psychological effects and mental health issues in people that are using them. Um, so yeah, the potency thing is another topic we could talk about forever on, there was no real all the testing done on cannabis to get recreational and legal marijuana in this country was done on 5% THC marijuana. So how that the 5% THC marijuana equates to what we have today, where you're increasing the THC and stripping out the CBDs, that's another issue, but that's the only thing that was allowed to be tested because that was what the University of Missouri, who had the DEA license to grow it, decided to grow because the 5% THC burned at a better rate or something for testing. So when you go to look, all the research on the non-adverse effects of THC or smoking cannabis are from those tests done on the 5% THC. Were there any questions in the chat?
Yeah, there's one from Julia. Well, she writes, I feel like people hear that there's accidental cross-contamination and still hear that and think that that means things are laced. But she writes, I'm wondering if there are any drugs you are seeing marijuana laced with.
No, no, no. You got to understand, drug dealing is a cash business. They want to squeeze every dollar out of you at that one particular transaction. They're they want if they have a $10 bag, they want the $10 for it. They're not going to put, marijuana and fentanyl together, and marijuana and this together, and charge you like a bundle package from Walmart or something. They don't care about repeat customers. They want they want to extract every dollar from you at that transaction they are doing with you at that moment.
I'm just scanning the, oh, another question just came in from Tiffany there in the Q&A.
Well, that's a good question. So I can't recall off the top of my head, Tiffany, and I apologize for that. Um, I don't really think the slow breathing, it's more agitation, kind of manicky kind of symptoms, anxiety, paranoia, things like that. Some vomiting, some, losing color in your body, your face, and um, that's what we see. But then there's also the long-term psychological issues that we're seeing, the from people who are maybe have undiagnosed mental health issues or susceptible to psychosis, that these high levels of THC or the using THC products every single day are bringing on. So Zoe, I was at a conference and there was a police officer speaking about illegal grow houses and where they found opioids dusted on the plants. Have you seen this? So I know California does have a lot of the West Coast states and even into Colorado have a big issue with illegal grow houses. I know Maine has an issue with illegal grow houses. I'll be honest, though, I've never heard about opioids dusted on the plants. I haven't seen any intelligence or any information on that. So I can't talk to that. Again, was it lab tested and they found the opioids on? That's what my question would be to that officer. And I'm not saying he's wrong, but again, he could be talking about they did field testing, presumptive field testing, and they said, oh, this dusting was opioids when really, and that's what happened in Norwalk. The Norwalk case, it had this white powdery looking substance on it, and that white powdery substance was the THCA crystals. But when they tested the cannabis with that powder on it, it tested positive for fentanyl. But when the lab got it, the lab didn't find fentanyl. They found THC and THCA. So that's why the laboratory testing is so important. Yeah, Emma, that's what I was saying about the safe supply people kind of co-opting this to promote dispensary purchases and get people away from the illicit market. Um, you know, uh, yeah, unfortunately, it may just be the new norm. So, Valerie, the case in Connecticut was confirmed through forensic testing, not toxicology testing, was confirmed through forensic testing done by the Connecticut Department of Emergency Service and Public Protection Division of Scientific Services Forensic Laboratory. That's a mouthful. And then also the DEA Northeast Laboratory. They both tested the sample and got the same results.
All right.
Good thing I only did a half hour.
Yeah. Yeah, I know we are at our time here, so I do want to let people, if you need to hop off, please feel free to. Bobby, if you have a minute to answer our
Uh,
last
yeah,
question here,
Jack,
that would be great.
I don't disagree with you. Again, I'm not a prevention expert, so I don't really want to comment on what the prevention messaging should actually be. But I mean, you're not wrong. I just don't know if that's the proper, what the proper messaging should be. I listen, I do kind of agree. One of the things we do in our tests and our presentations, our trainings, when we talk to people, we always stress if you think somebody's overdosing or using substances and they're not looking, if you have naloxone, hit them with the naloxone because, you know, it can't hurt and it probably will help because, you know, listen, I know a lot of people, no judgment zone, that have a substance use disorder are on, methadone or Suboxone, or they use illicit opioids to not get sick and not go in withdrawals, but then will smoke, you know, cannabis, in their minds, they think they're mellowing out or, getting high or numb, whatever you want to call it. So they're going to have some opioids binding to that opioid receptor in their system. So, I think we live in a world where people have polydrug issues. So I always err on the side of if you have it on you, use it. It can't hurt. Could people be thinking that cannabinoid? Oh yeah, I'm not even going to try and pronounce that. That actually is a pretty good observation, Chantel. I would agree with you there. I do think a lot of people, again, subconsciously, I think like there was probably like 200 and something people on this call today. We all work in this field, right? So we all think that everybody must know what an opioid overdose looks like. Everybody must know. And to be honest, they don't. They don't know what it looks like. So when they see, and in their minds, they don't equate cannabis or THC products to having adverse effects. So whenever they see somebody having an adverse effect, their immediate assumption is fentanyl because, like it or not, the media and everybody has kind of made fentanyl the boogeyman for one reason or the other. So everybody who doesn't work in this field day in and day out or work with clients who have a substance use disorder, they immediately gravitate to that fentanyl image and that word because the media and a lot of people have made it the boogeyman. So
Yeah, absolutely. I think that what you brought up is just a really interesting example of the ways that our stigmas and biases impact, yeah, how we interact with these messages, how we interact in our, whether we're doing prevention work, law enforcement work. It's very complex topics, but thank you
yeah,
so much for walking through that kind of the detailed info, sharing your insights and data with us. I will send out certificates for folks within 1 to 2 weeks. And if folks have any other follow-up questions, please feel free to reach out to me and I can connect you as needed to Robert or to other New England PTTC resources that we have. So thanks, everyone. Have a great afternoon.
thank you.